This is QD Clinic. Hi, I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live 2024. We have a session on JAK inhibitors that I think is going to be stellar. It's JAK inhibitors in spondyloarthritis, Eric Ruderman, safety of JAK inhibitors, Kevin Winthrop, and new indications for JAK inhibitors in dermatology, Bruce Strober. I mean, it's a killer session. Be there. Today's case is, why aren't patients like textbooks? So this patient that I just saw is 52 years old, a gal who has been seen probably for about 8 or 9 years in the past by 2 other rheumatologists in town, and she comes to me with uncertainty and continued complaints. Uncertainty in that she says she's had pain and swelling in a number of her joints, in hands and wrists and shoulders and elbows and back and arm and whatever. And she has previously had abnormal tests, an ANA of 1 to 40 and an ANA of 1 to 80. But she did have an elevated SED rate and CRP. By one doctor, she was called inflammatory arthritis, and he wanted to give her DMARD. She didn't want to take DMARDs. She was treated with intramuscular and intraarticular injections and really was self-managed. Another doctor saw her, said she also had maybe RA, but also fibromyalgia. When I see her, she's got predominantly left wrist pain and swelling. She's wearing a brace on the left hand to limit the range of motion and limit her pain. She's also got pain in her neck and shoulders and down her right arm and also in her buttock areas bilaterally. She sleeps poorly. She does have fibromyalgia. She does have a limitation of motion in the right shoulder and an old, what seems to be established, minor frozen shoulder, now with limitation of motion and pain. Given her occupation, does some manual labor, she probably has a rotator cuff tear there that's been going on for some time. But the left wrist is the other problem here. So I'm willing to ascribe this to, fibromyalgia, poor sleep, some degenerative change, something that needs physical therapy. But the left wrist is 1+ swollen. She's lost about 20% range of motion, inflection, and extension. The CRP was 31 milligrams per liter, one assessment. And on another assessment, the SED rate was 56. So the question is, what does she have and what am I going to do? So I'm working in a clinic where the patient doesn't have insurance. So you're paying for everything. And what are you going to do? So that she does have established long-standing complaints. So the chronicity of the wrist problem with the limitation of motion says something's going on there. And the question is, can it be diagnosed by simple means, either an X-ray or an ultrasound? Or will she need more expensive tests like an MR or CT? First, we should and of course, by the way, other tests are all negative, right? Uric acid, LFTs, CCP and rheumatoid factor were negative. She has no hepatitis antibodies in play. She has no thyroid disease. So the labs don't show anemia of chronic disease. Her platelet count is normal. Her chem profile is normal. Creatinine function is normal. So I'm left with an elevated SED rate and CRP and swelling in the wrist. And it's cool to touch, but it is soft tissue swelling. There is no tenosynovitis or tendinitis by my exam. And the wrist pain is over the dorsum of the wrist especially, and when that's where most of the swelling is. And she gets pain with more flexion and extension than she does with side-to-side motion, for instance. But nonetheless, what am I going to do? What's the differential here? Isolated wrist pain, the wrist is involved in a lot of different arthropathies. It's involved in RA and CPPD, but I would expect multiple joints in both those conditions. So I'm really excluding those. I guess CPPD still could be in play. The wrist is a common place for calcium pyrophosphate disease deposit, affecting the cartilage, giving a minor inflammatory reaction. It can also be in play when someone has hemochromatosis that may involve the wrist as well. But again, no diabetes, no heart, normal LFTs. I didn't do a ferritin level on her as yet. I'm really looking for a differential that gives you an oligo or monoarthritis that involves the wrist. And I think you have to strongly consider traumatic causes, periarticular causes, tendon disruption, tenosynovitis, Dacre veins, all of those. But isolated arthritis, intercarpal, radiocarpal involvement, you should probably think about psoriatic arthritis, reactive arthritis, IBD arthritis. You should think about trauma, fracture, and damage if there's been any history of trauma. If she has had trauma, you could also think about a foreign body reaction, a foreign body synovitis. Infections are notorious for giving you isolated monarticular, oligoarticular complaints. And the more that they're chronic and indolent, the more you have to think about weird bugs and starting with atypical mycobacterial infections, non-tuberculous mycobacterial infections. Lyme can do this, and like I said, hemochromatosis can do this. Chimepox, which is an avascular necrosis of the lunate bone. I've seen a few of those in my career. They tend to be on the younger side rather than really old people, and the diagnosis usually is made by MRI, seldom by X-ray, unless it's very long-standing, in which case the lunate will be deformed, sclerotic, and suggest prior AVN of the lunate. So my initial plan with her is to get X-rays, give her 5 milligrams of prednisone, manage her fibromyalgia and sleep disorder, give her range of motion exercises for the rotator cuff limitation that she has, and we'll see her back. I'll do further X-rays and imaging if I need to, but it's going to be costly, and she doesn't have insurance. So maybe you can get an MRI on a cash basis, on a compassionate use, if you think that there could be an AVN or bony abnormality or a fracture, whether it could be a scaphoid lunate ligament tear. Again, there's a lot of bone and soft tissue possibilities here. But again, the swelling to me looks like a chronic inflammatory mono-oligoarticular arthritis, and that's why I'm hoping she's got either a crystal-related or inflammation-related. Giving her prednisone doesn't really fix the problem, does it? When it comes back and she's better, what am I going to do? Chronic polyarthritis has to begin as a monoarthritis in some people, except this has been going on a while. Again, I can't have no great documentation as the extent of arthritis she had 8 or 9 years ago, but I'm going to have to learn who she is. And again, the point here is, here's a patient who comes in with pain all over. The conundrum is the left wrist, and she's got several things going on, not just one problem. She's got a wrist problem, a shoulder problem, a sleep problem, and a chronic pain disorder in the form of fibromyalgia. Yes, patients don't read textbooks. And basically, in this case, I'm going to treat each one of these problems individually until she's better as a whole. Tune in for more QD Clinics.